Can birth control pills cause polycystic ovary syndrome or PCOS? I got asked this twice this week by patients, and I figured there's lots of other people who have questions. So let's dig into it. PCOS is a condition where your pituitary gland in your brain doesn't send the right signals down to your ovary. You don't release an egg every month, you don't ovulate, and there's lots of other hormonal imbalances such as extra hair growth and other things that can go on. Can birth control pills cause it? The short answer is absolutely not. The longer answer is, why do people seem to, when they stop birth control pills, then start developing symptoms like PCOS? So let's review that. Birth control pills, traditional estrogen plus progesterone birth control pills, are really great because they help you regulate your cycles and have a very nice every 28-day period. When you stop them, you have to go back to relying on your pituitary gland to regulate your cycles. And if your pituitary gland, which is not really affected after you stop the pills, because remember, you take a pill every day. Once you stop them, they're out of your system. If your pituitary gland is not doing a good job at regulating your cycles, it will go back to not regulating your cycles as soon as you're done with the pills. So the pills don't fix it permanently, they just fix it temporarily. And so if there's an issue, it can cover it up. The other thing I will say is that birth control pills, especially ones containing estrogen, increase a binding protein called sex hormone binding globulin. And sex hormone binding globulin is like a sponge, and it sucks up all kinds of extra hormones in your system. The one we think about is dihydrotestosterone, DHT, or free testosterone. And because of that, it lowers your free testosterone levels. This is why birth control pills can sometimes lower libido, but it also lowers extra hair growth. So if you're someone who gets extra hairs in places that they don't want it, face, belly, chest, all those things, if you stop your birth control pills, your sex hormone binding globulin drops, and then all these hormones are no longer sucked up by that sponge, and so they're running around in your system causing havoc. That is why birth control pills, when you stop them, can cause symptoms of irregular cycles and hair growth. They didn't cause PCOS, but they're no longer covering it up. I hope this helps explain those questions, because I think it's really common for people to think that birth control pills can cause long-term problems, when in reality, they don't.